Deputy Mary Lou McDonald, 3 minutes.
Taoiseach, you said in response to that first question that our most valuable citizens are our children. Well, I want to challenge you and your government on that, because it's very clear to me that on your watch our children are not our most valued citizen. This morning, Temple Street Children's Hospital released figures for the number of children that presented to their emergency department last year and who were subsequently discharged with no fixed address. That number, Taoiseach, disgracefully stood at 842 children. That is 842 of the most vulnerable citizens of this state, and I would suggest to you citizens that are not valued or considered at all. Not alone do these children need medical care in an A&E, but they also need a home. Anyone who heard the lead emergency medicine consultant from Temple Street on the radio this morning couldn't but have been shocked. He said that presentations were varied and complex, but in the majority they stem from the fact that these children are living in completely unsuitable, cramped and temporary accommodation. So not alone are these child citizens left without a home, the state sponsors a system in which they live in, let me repeat, unsuitable, cramped, temporary accommodation. That's their reality. And of course, this isn't just about numbers. But I would put it to you, if the figure is 842 children from Temple Street, what's the situation in every other hospital across the state? Can you tell the Dáil, Taoiseach, what is the total number of children being discharged to no fixed abode right across this land? And can you reassure the Dáil, Taoiseach, that you understand the extent of this damage to young lives that are destroyed really before they've started, before many of them have uttered a word or learnt their ABCs or even had their first day at school? Most of them have never known any place called home. Instead, they've known family hubs, hotel rooms, B&Bs, where mould on the walls and on the ceilings impacts on their ability to breathe, where they live in cramped conditions and they get scalded or burns, or where children are self-harming, where children with cystic fibrosis, with neurological disorders, autism and disabilities grow up in cramped, unsuitable and dangerous accommodation. And what if their parents, Taoiseach, a thought for them? They expect to raise their children, as we all do, in a society that exhibits some semblance of decency, in a country that has some bottom line around how we treat our children. So, Taoiseach, can I invite you to share with the Dáil what is the true figure? What is the figure across this state of children discharged from hospital into homelessness? And what have you to say to them and for them and to their parents?
3 minutes.
Thanks, Deputy, for raising this important matter. Children are without doubt the most valuable citizens we have in our country. That's why we introduced free GP care for all children under 6, so the parents don't have to worry about where they're going to find the money to take their kids to see their doctor. It's why we introduced 2 full years of free preschool. It's why we've extended things like maternity benefit and introduced paternity benefit. It's why we're investing so much in the affordable childcare scheme, which will be expanded this year to include middle-income families as well, making childcare so much more affordable. It's why we've improved child protection, established TUSLA, brought in things like mandatory reporting. It's why we've worked so hard to increase the number of parents who have jobs, to increase living standards and pay, to improve our welfare system, to increase the child dependent allowance, to improve the welfare system for one-parent families. And that is why we have seen child poverty fall for each of the last 4 years for which we have numbers. It's why we've seen the number of children suffering deprivation fall for each of the past 4 years for which we have numbers, because of the improvement of the economy and because of the social policies pursued by this government. In terms of the question that you raise, I don't have a figure for the other hospitals. Government doesn't collect those figures, but perhaps those hospitals have those figures if you wish to seek them from them. But I do know that going to an emergency department is a very stressful experience for any parent, and I'm sure that is compounded if you're living in emergency accommodation as well. And none of us want to see children forced to live in emergency accommodation. None of us like the idea of children having to do their homework on a hotel bed or having to share a room with an adult, with a parent or so many other kids. And that's why, for example, we've invested in the family hubs, 26 of them now. I know it's not a long-term solution, but it's certainly better than a hotel or a B&B. It means that children have an address, it means they have play facilities, it means they have washing facilities, it means that they've somewhere to store their belongings. And I've been to visit those family hubs, spoken with the families who live there, and none of them are places such as what you describe in your contribution. And it's also why we're ramping up the provision of social housing in this country. We don't have the exact figures yet, we'll have them in a few weeks, but we believe that we've roughly increased our stock of social housing by 8,000 last year. So that's 8,000 individuals and families living in a social housing home that wasn't part of the housing stock only a year ago. Over 4,000 of those being new builds by local authorities and by councils. And that is the solution. It is supply. It's providing additional housing, additional social housing, so that we can get those families out of emergency accommodation and into secure tenancies, doing and housing what we've already done in health and childcare and education and on welfare and on incomes. The reason why we've delivered on reducing child poverty, on reducing child deprivation, is all of those things. We need to apply the same now to housing as well.
Deputy McDonald, is 1 minute.
So none of us wish to see these things happening, but they are happening and they happen on your watch. That's the bottom line. And you are the Taoiseach, you're the head of government, and you carry the can for this. Now, despite all your self-satisfied patter, the reality is that discharges of children from Temple Street Hospital into homelessness is up, not down. It is up by 29%. And the reality is that you have normalised this homelessness, and that's how you can stand with a straight face and read a list of your avowed triumphs to lift the yoke of poverty from child citizens. You actually buy into that. You have normalised child homelessness, and it seems you make no apology for it. You visited these family hubs. The key word here, Lascan Corley, is visit. I don't think anybody here in this chamber would tolerate living in one of these family hubs or having your loved ones live there either. I wonder, Taoiseach, have you visited the B&Bs or the hostels or the hotel rooms? I can take you there. There's lots of them in the North Inner City, where young mothers and young parents struggle with small children. And never mind my contribution, listen to the doctor.
Question to the Taoiseach, you have exceeded your time.
Thank you, Lascan Corla. There are maladies and injuries, he says, not me, the medical expert who treats these children, stem from the fact that these children live in completely unsuitable, cramped and temporary accommodation. You don't have the statewide figures. I invite you, Taoiseach, to get those figures when you have them, to present them to the Dáil. And I invite you again, rather than giving a self-righteous patter, to give words of reassurance and response to these children and their parents.
I have visited hostels, Deputy, and I have met parents who were living in hotel accommodation, and thankfully some of those now have been housed by this government. Roughly 50,000 children attend Temple Street every year, 800 of whom last year were living in emergency accommodation. And as you'll know from the study, attended for reasons like chest infections, abdominal pain, diarrhoea and vomiting, high blood pressure, chronic diseases like asthma and epilepsy, injuries, all of the many reasons why any child might attend an emergency department. But of course, if they're living in emergency accommodation, that complicates it. And that's why we need to get them out of emergency accommodation. And we're doing that. How are we doing that? We're building the family hubs, providing them much better accommodation than a B&B or hotel room. Not a long-term solution, but a much better solution than B&Bs and hotels. And we're building more social housing. 8,000 additional homes added to the social housing stock last year, most of which are new builds. We need to get that up to about 10,000 this year.
Deputy Brendan Harlan has 3 minutes.